Something that I personally have struggled with, and I guess I see really a lot of other guys that are on TRT, or whether they're, blasting and cruising using super physiological amounts of androgens, is sometimes a like increase in their brain fog, or just feeling like you're starting a sentence and then you're like, wait, what was I even saying? And you would think it would be just the opposite, right? You're on hormones and they should make you feel good. Any reasons as to why you think that what could cause this, or your thoughts on that?
Yeah, I think it's multifactorial, like a lot of things, though. I think one of the biggest players is the neurosteroids. Something like a compound called pregnenolone, I think, has a vital role in this. I've seen this through myself, and so I might be a little biased. I might be thinking about it just because I have experienced it myself, and it was something that definitely helped me. Though, just a little background, I used exogenous steroids for a long time. I found that probably after 10 years or so, I kind of felt like my brain was declining. I felt a loss of verbal acuity. I felt like I couldn't string my sentences together as well. I felt at loss for words a lot of the time. It really worried me. When I was going through that, I didn't think to investigate my neurosteroid profile and look at those metrics. I kind of chalked it up to potentially the oxidative stress, which I definitely think plays a role. So that would be one area as well. I think that when we are using a lot of compounds, especially underground lab compounds with a lot of different additives and chemicals that may not be conducive to brain health. They cause a lot of oxidative burden. It can lead to brain fog. Also, just the heavy lifting that we do. We do know that, that causes a lot of oxidative stress. We have bouts of hypoxia when we're doing Valsalva maneuver. We're putting our body and our brain under a lot of stress. That would be one component. But again, I failed to look at my neurosteroid profile. And when I did, I saw that my levels of pregnenolone were undetectable. They couldn't be found whatsoever. What we see clinically when levels of pregnenolone are that low are a few things. And one is brain fog. That same loss of verbal acuity is a big one that a lot of guys will go through or experience, where you may have experienced where you're trying to talk and you just can't think of the word, and you lose it. Another one would be feeling like you can't ever wind down, feeling like you're always in that fight or flight. And we'll see this when guys even start TRT if they haven't looked at their neurosteroids. So when they get higher levels of free testosterone, they're almost unable to handle it. They get insomnia, they get irritability, they feel very anxious, and then they're left trying to lower their testosterone dose, but then they run into lower testosterone symptoms. And so that's like, you're chasing these things all around, and they're failing to look at their pregnenolone levels. And when they do, we optimize those, often those symptoms kind of resolve, where guys can tolerate a little bit higher levels of testosterone without that fight or flight. They get a lot of that mental and verbal acuity back. They feel reduced brain fog, feel better mood. They feel both more energized and able to relax, even though it sounds a little weird, but it can have impacts on both. So I think looking at your neurosteroid profile, also considering, are you taking things like 5-alpha reductase inhibitors like finasteride or dutasteride, which downstream can have negative effects on neurosteroids too. So again, I think it's pretty multifactorial, but two areas I'd look at: oxidative stress and neurosteroids.
Great. Yeah, and just an anecdote to add on to that. Personally, I was saying that I've struggled with this, and recently have started supplementing with pregnenolone. And obviously, we don't recommend you throw in anything without blood work, as Dr. Hotckiss was saying, to indicate that you need it. But it has certainly helped with just my mental acuity, and feeling like at the end of the day that I can kind of tone it down and get to bed, but also, as we're saying, have a little bit more energy as well.
Yeah, very, very common.